This is the Real Health Podcast brought to you by Riordan Clinic. Our mission is to bring you the latest information and top experts in functional and integrative medicine to help you make informed decisions on your path to real health.
Hello, once again, everybody. Welcome back to the Real Health Podcast. I am Dr. Drew at the Riordan Clinic here. I am joined by my friend, Dr. Clayton Dir. Clayton, you are a physical therapist, is that correct?
It is, I am.
All right, man. So give us a little bit of context. Who are you? Where are you from? Kind of just give us the background of who you are.
For sure. So I'm born and raised in Wichita, Kansas. Grew up in Goddard, actually. And when I graduated high school, went to college at Oklahoma State University. I wanted to start in athletic training. Like every person like me, I wanted to work with athletes.
Okay.
Found out the work load is high, the pay is low, and it wasn't really going to help me get into physical therapy school anyway.
Yeah.
So I came home, started living at home, much cheaper. Finished my bachelor's degree at WSU, and then went into PT school also at WSU,
All right.
which is a 3-year doctorate. And I think a lot of the times people picture physical therapy as either post-stroke or post-surgical or a 70-plus-year-old person trying to balance, and that's not exactly what we work with.
There's a lot more than what you do.
So much more, yeah.
Okay, before we get into that real quick, because I do have a lot of questions about that.
Mm-hmm.
So you mentioned kind of the education piece. I think it's really important because when I got out of medical school, when I was in residency and started getting to know the physical therapist from the hospital side of things, you guys have a crazy amount of education as well, correct?
Mm-hmm. Yes, we don't go to the level of yours. I know yours is a little bit longer, but I think it's much more than the average person knows.
So what? Yeah, so you have your bachelor's.
Mm-hmm.
Ideally 4 years, right?
Yeah.
And then what is after your bachelor's?
Then it's a 3-year doctorate. So it's 9 semesters because we go summer, fall, spring, 3 years in a row. And then that's a doctorate.
So you're basically going to medical school.
Yep. It's just a year short. And then we don't have residencies.
Okay. So, okay. Real quick, because we kind of will get into a little bit more in depth about, natural wellness physiotherapy that you have here.
Mm-hmm.
But what are some of your own values that have shaped that you as a healthcare provider?
I think it's the experience in which you go through, whether it's yourself going through the medical healthcare climate, witnessing a family member. And then when I went into PT school and we have clinicals, different observation experiences, and then things that you like learn on the job. And I just remember sitting across from patients thinking, do you even know what's wrong with them? Like thinking to my CI, like, do you know what's going on? Like, this has been like 3 weeks and they're still not getting better. We need to do something different. And I just remember always being frustrated, asking the person to keep coming back. And we were doing stuff that made them feel better short term, but never solving problems.
Right.
And I think that's what like really like kept putting a chip on my shoulder. Like, I'm going to figure out how to actually like fix this person or help them or like change the one thing that needs to be changed in their life or help them change that. Mm-hmm. So they actually feel this somewhat transactional benefit from coming to PT where they actually feel different when they leave, as opposed to like, no, just trust me. Twice a week, 6 weeks, just magically at the end of it, you'll be better, even though we've already been coming for 4 weeks and it's no different. Like that's what was frustrating along like that whole path. And so that's what shaped how I and we practice today.
So this very much mirrors, as you were talking, very much mirrors kind of my own journey in from conventional medicine over to integrative medicine. It sounds very much like root cause analysis.
Mm-hmm.
Really try to get to the actual root of the issue so that you can develop a functional plan moving forward.
Yes.
Sound about right? Okay.
Mm-hmm.
So with that, kind of the meat of why you're here, tell me what it is you do and just all about the business.
So at Natural Wellness specifically, one of the big things that I think we get right from the get-go is if you were to call in and come to our clinic, you're probably going to spend anywhere from 5 to 20 minutes on the phone with our client liaison. So she can get a good understanding of like, what have you tried? What's worked? What's not worked? And then also tell you about our clinic and how we're different. And usually people already feel the difference at that point. But then when they come in, our evaluations are an hour long. I think our paperwork is really good in regards of asking a lot of questions ahead of time of like, again, same thing. What have you tried? What's worked and not worked? Right. Who else have you seen? Some other questions in regards of medications and all that jazz. But there's times where I've spent 20 to 35 minutes talking out of the hour, well, more listening. But my point being is like not even touching the patient yet or evaluating them, but just listening to their story.
Yeah.
I actually had one patient that came in last week that found me through TikTok. She's tried 5 different PTs, 4 different chiropractors, 3 massage therapists, and been to a couple other medical doctors. And she's probably one of the more straightforward cases I've ever seen. And I'm like, how has everybody missed this? It's pretty straightforward.
Yeah.
And that's what I think has also been eye-opening, where I don't think I'm doing anything wild. And I know you've probably had similar patients where you're like, this is pretty straightforward. What is everybody missing? And then you kind of just realize like, I think there's just a lot of people missing things as opposed to me being any sort of smart.
Well, and I think what you said there is you can spend, over half the appointment just listening.
Mm-hmm.
I think that's the biggest part, is taking the time and having the time to understand the patient's story, their own journey, and how they got to you.
For sure.
So that in and of itself is a huge part of what we tote here at Riordan Clinic.
Yeah.
So with its natural wellness physiotherapy,
It is.
correct? Okay.
Mm-hmm.
Where is that again?
We have 2 clinics. Our main headquarters is at Kellogg and Greenwich in Wichita on the east side. And then we have a satellite clinic, essentially just rent an office from a gym at Kellogg and Tyler out west. And I'm usually there a day and a half a week so we can reach west side.
I didn't know you were on the west side.
Mm-hmm.
Awesome.
It helps people drive from Andale. It's a 20-minute drive, not an hour.
That's actually
so
fair.
It really helps
Yes.
catch west siders for sure.
I was born and raised west side as well. So I understand.
Yes,
it can
absolutely.
be a big difference. So, okay. Why exactly is it what you do? Why is that different from traditional physical therapy?
So I think one thing I already alluded to is most PT is just written down as like, hey, evaluate and treat twice a week for 6 weeks. And you're usually with a PT anywhere from 20 to 40 minutes. And you may not even be with that physical therapist the whole time because patients are getting double and triple booked within an hour. So that PT may be bouncing between patients. You're either with you're probably with a PT aide, which is usually just a high school kid trying to get some experience.
Okay.
And so you go and people are like, well, I've tried PT before and it didn't. Like, tell me about your experience. And it's usually like I showed up, I got on the bike for 10 minutes. The PT asked me a couple questions. And then honestly, we just went through that piece of paper they printed off for me. And which is the stuff I'm supposed to be doing at home and at clinic. And then I go home and I'm like, yeah, I wouldn't go back either.
No.
Right. And it's like, and then you like look at the guy next to you who has shoulder pain when you have knee pain and both of you have the same exercises. And you're like, this doesn't make sense.
Yep.
That's traditional PT and like kind of learning in. And I'm like, there's got to be a better way. And so with that, the difference in which we have is we have that time to sit and listen and help diagnose. So we are always told like the patient will give you the answers kind of in that path. And then I think a couple big distinguishing factors is we do dry needling, which is very helpful for patients.
That's awesome. Yeah.
It really helps decrease tension in the muscle, which also helps with pain relief. But ultimately what I think it really does is it helps us shortcut and give them benefits within a day or two so they can get this buy-in and commit to the homework.
That's amazing.
Because you prove to them like, we have found your problem. This hurts, right? Yes. Dry needle it. Does that feel better? That feels a lot better. Cool. Do your exercises and it'll stay that way. Yeah. And then they're locked in, like honestly. And so we usually see people once a week for 4 to 6 weeks and then we space it out. So I may see you 10 times over 3 months as opposed to 12 times in 6 weeks.
Okay.
So it's a lot more spread out, especially because we know strengthening takes 6 to 12 weeks. So traditional PTs discharging, you kind of just got your habits built.
Okay.
And you may not actually be fully better yet.
So take me through that, since you already mentioned that. Just kind of take me through that whole patient journey from, you already kind of said that 10 to 15 minutes or 20 minutes even on the phone, first eval all the way through that whole 3-month period. Like, what does the patient experience?
That first phone call really helps make it to where even the hour, which is a decent amount of time that I get with you, is already much better because I come in very well informed on what's going on.
Yeah.
But the first probably 4 weeks is mostly pain relief. We have a 3-step process called reset, restore, reload. Okay. Reset the pain cycle, get you out of pain.
Yeah.
Restore full strength and range of motion. I usually tell people this is where we fix or help you fix or strengthen or stretch or whatever got you in pain in the first place. And so it's that second month-ish, depending on the person, that we're still probably seeing you weekly, maybe going off to bi-weekly, that we're working much more in strengthening. Most of the time, 70, 80, 90% of your pain is gone.
Yeah.
And we can really start building in some strength habits, maybe talking about sleep, hydration, nutrition, stress management. We're bringing in those conversations. And then that third month is usually when we're out to 2, 3, 4 weeks between visits. And that's where most of the time it's like, hey, have you got with that personal trainer I recommended? Or have you started that running program that we talked about? Is there anything else you need from me? Like, we're setting stuff much more on autopilot. And then we have maintenance programs where if people want to stick around monthly for dry needling, for health coaching, whatever it may be, that's usually where we're seeing them once a month or so, or discharged.
That's incredible. I mean, you brought up some things that I've never heard brought up in physical therapy before, and talking about lifestyle, sleep, nutrition, like all of these different things that go into it. That is how you health.
It is 100%. Well, and what I found is there's still one patient in particular. It was still within my first year. And she was like, Clayton, I'm doing everything. Like, why is my hip not getting better? And this girl, she was, I think, either mid 40s or late 40s, does CrossFit 5 or 6 times a week, looks how most people would want to look, male or female, in regards of her physique. She was looked like doing everything right. And I'm like, I'm dry needling. I know I'm in the right spot. You're responding well. You feel good for 2 or 3 days. You're doing your exercises. Like, what are we missing? And I'm like working on her hip. It's like visit 8. And she's like, yeah, my son was saying I need to eat more. I'm like, how much are you eating? 1,200 calories. 1,200 calories won't give you enough energy to lay in bed for the next hours, let 11 times a week CrossFit.
Yeah.
And I was like, this should have been a visit 2 conversation. Like, I need to proactively ask this. Like, why was I not doing that? And so it's been a lot of like trial by fire, right? Like, I'm sorry to my earlier patients that I didn't bring this up earlier,
right.
but we are only going to heal you as fast as your body can allow. You need enough fuel. You need enough sleep. You need enough hydration. You need to be not overloaded by stress mentally. Otherwise, we're going to be governed by that. And so those started, well, they're very early on in the conversation now, but they've slowly been brought further or closer and closer into the beginning of the plan of care. That's necessary.
That is incredible. I love hearing that. Because it's little things here and there, like 1,200 calories a day. I was going to say, I was like, you're not even making your basal metabolic rate at that point.
Yeah.
So, and then things like restoring, getting enough sleep. And I love that you talk about, stress. You cannot be mentally stressed, in order to do all the things that you need to do to get
Or
healthy.
you at least need an appropriate outlet, or you need to understand this is going to go a little bit slower because of that big project you have at work, or that like you just losing a loved one. Like there's going to be some hindrance here, and that's okay, right? Just having space for that conversation to
I love that. I always describe medicine as an orchestra, and being kind of the person there conducting this, being the doctor and the healthcare provider, whoever it may be, conducting this orchestra on all the different areas of life.
That's
so it very much sounds like you're doing the exact same thing.
Mm-hmm.
So okay, you talked about some of the other therapies that you can do there. So for those of you who don't know yet, because I haven't mentioned it, but I have actually been to Natural Wellness Physiotherapy. And when you walk in, you've got a really nice front desk area. You've got a couple of offices as you go down a hallway, and then you open up the door and you've got the gym in the back, which is phenomenal. You talked about doing some dry needling. Is there anything else that you do there, like therapy wise?
Yeah. So when it comes to, I think you're mostly referring to like manual therapy is what we'd call it in our world. So hands-on stuff to help break pain cycles. Dry needling is definitely the biggest one we use. I'd say probably 80+% of our patients we do it with, because it's what helps us get the fastest results and generally the most permanent. We also do what is called like IA-stim. So instrument assisted soft tissue mobilization. Some other terms that have been used is Graston or gua sha, but ultimately us using some sort of plastic tool to scrape or rub over the skin to try to invigorate a little bit of a local inflammatory response, not systemic inflammation that you'd see on blood work, right? But like, hey, let me inflame this local area so the body heals it by sending blood flow to the area. We also have myofascial cupping. We'll also do trigger point release and soft tissue mobilization, so hands-on work. We can perform what's called grade 5 mobilizations, which in chiropractic care is usually called an adjustment. So we can pop joints, the entire back, spine, everything. I think that's most of the manual stuff that we'll use, but it's probably in that order in which we actually utilize it too.
That's cool. That's awesome. So having a whole like toolbox as opposed to just like one tool to actually go after the same thing. You can't beat everything into submission just with a hammer, right?
And it's amazing too how like some people won't be responding to scraping, for example. And it's like, let's try cupping. There's not a ton of research behind it that it's like this greatest thing ever, but there's some. And then like that's what unlocks everything. Like, glad I have that tool. I'll use it more often. Like,
do you have any way of like deciding, or is it more like a conversation with the patient, or like what modality is going to be best for them?
Expectations and past experience probably dictate most.
Okay.
I'm really scared of needles. I really don't want that. Cool. We'll use it if we need to. I'll teach you why it could be helpful, but we'll stay away from it for now. But most of the time I would say if it seems like, wow, it hurts really bad right here, and they pinpoint a muscle belly, probably going to dry needle it. If it's my whole knee hurts and I can't really place where, that's more of a scraping kind of thing.
Okay.
I'm oversimplifying. Cupping I've seen work really well with either nerve entrapments or swelling, or like that spot in your mid back between the shoulder blades that only hurts when you reach across your body or something. We'll like put the cup or a couple of them in that area and then have them do cat cows, thread the needle. We'll have them do a bunch of movement with the cup there, and it seems to loosen up that spot a little bit better.
That's awesome.
Yeah. And so again, you can mold it like crazy to the person and to their experience. And if you try something that doesn't work, cool. Next visit, we're going to try this next thing and see if that works better.
So individualized care.
Very.
That's how you find your own health. Something else that we preach here at Riordan Clinic, it's one thing might not work for, this 7 different people who have the exact same diagnosis. there's so many other areas of life that actually dictate how you got here.
And we have the luxury of time to try those things too.
That's great. Yeah.
Mhm.
So, okay. Talked about modalities, kind of talked about the layout and everything, but are you the only one there? What kind of staff do you have, and what's their backgrounds?
Great question. So I'm the clinical director. I would say I primarily focus on complex cases. People have seen 10, 15, 20 other providers, which is honestly wild to me. And then weightlifters, strongman competitors, powerlifters, and CrossFitters is kind of my jam. We can all treat anybody though.
Cool.
I've got another gal, her name's Allison. She treats primarily runners, plantar fasciitis, and vertigo. So when you stand up and the world starts spinning, she'll treat you generally 2 or 3 days in a row and clear it up almost every time. It's honestly wild. Again, she can still treat anybody, but that's generally her jam. And then Kirsten, she's a pelvic floor specialist. So moms or ladies who leak when they jump or when they weightlift, postpartum, prepartum, all of that world. And then humorously enough, she really likes working with stubborn middle-aged men who won't listen. She does great with them. They also won't listen to me, but she does well. And so we all have our like little niche, which is really nice. When I have somebody that I can't like get better, I'll just be like, hey, you're going to go get treated by her for a session and let's see if we can get a breakthrough. It's really nice to refer within, but we can all treat anybody.
That's amazing. You can, I mean, and have like the group, because I've always talked to you about how medicine's a team sport.
It is. Yeah. It's really nice when you can just ask a question across the whole, like, hey, what should I do here? Because we've tried a bunch of things. Like, you should look here. And again, it's always clear to the person on the outside.
So part of the reason I wanted to have you on the Riordan Real Health podcast here is one, I was on one of your podcasts a couple months ago. Seems like it was not that long ago, but simultaneously like last year.
It was all of it. I agree with you. I'll just agree with you.
So we met at a conference. What was that, at WSU? And it was some small business conference.
We'll just call it the health fair.
Yeah, health fair.
I don't remember. It was for small businesses.
And just for context here, Clayton and I just started talking after I gave like a 10, 15-minute speech about what Riordan Clinic is and everything. And it just obviously things clicked, right?
Yeah.
Very similar values, very similar backgrounds as well. Love that you're a Wichita State grad, same, born and raised Wichita. So moving forward, kind of where we are today, how do you see a Riordan Clinic and natural wellness physiotherapy helping the community find their health?
What I usually see is there's a lot of stuff that we do well, but there's huge gaps in which it's just like, I'm sorry, that's out of my scope. Or I think there's a phrase that I've used before, and it's, I know that there's somebody that exists that will look at your case and say, this is so obvious. This is what it is. And it's the hardest part is just finding that provider. And I think for the complex cases that either I can't solve, or as we go through a plan of care, they mention they have this metabolic challenge, or they have somebody that also has this other issue. And I'm like, well, that's not a PT problem. But I know with the complexities that you've got, your regular PCP or primary care physician or general practitioner is just not going to be equipped for that. And that's where I feel like the Riordan Clinic can completely supplement that, because I just think there's so much here that people still don't even know about, that you guys unlock those complexities and make them simple. And so that's what I think you can benefit to our clinic. And then I think there's a lot of stuff that you guys do here that needs the week to week conversations, or like the strength building, where it's like, listen, like, here's all the stuff that we can do to help. But if you don't have some sort of healthy lifestyle in regards of just movement, then you're going to be governed or like held back on how fast it can go. And so I think that's where we can supplement you guys in regards of being along week to week with that person, help them build those healthy habits. Yeah.
I mean, we have a large subset of what we call co-learners,
which I love, by the way. I think that was my favorite part of your presentation, is the fact that you guys call them co-learners. I'm like, thank you. This is a team sport, including the patient.
Absolutely. We have to figure it out together. And it's not just me telling someone else how to get healthier. And having that value there, I think is definitely a shared brain here. But we have some co-learners here that come in for things like prolozone, or, I do OMM, osteopathic manipulative medicine. And there's still times where I'm with you. You can kind of just bang your head against a wall and like, I don't have other modalities here. So I see a lot of these people being referred to you as well, and having that partnership here. So ideally, in an ideal world, you're a Wichita boy as well. Where would you want to see Wichita in like 50 years from a healthcare standpoint?
Oh, man. Well, honestly, I think you guys have a seed here that needs to get watered ultimately and grow, because I think there's a lot of people here in Wichita that are just like, well, I guess I have to drive to Kansas City for that, or Oklahoma City for that. And I don't know exactly what that looks like in particular, but I know there's a lot of stuff that we do that's cool. But when it comes to like either hormone balancing or certain blood tests or whatever, that I'm like, oh, if we could just like flip a switch and fix that one thing or find the problem there, like everything we're doing can take off, because there's certain stuff that we'll be doing. And I'm like, I can help you for 3 days, but your body's not cooperating. Your body's not carrying out the process that normally takes place after this treatment or after this exercise. And that's what we need. And ultimately, I think that's what Riordan's got. And so it's how do we either bring that under one roof, or how do we make this like nice blend between the two of us, where it's like somebody shows up and it doesn't matter what they've got going on. You essentially show up to the room or show up to the campus and it's like, oh, you have that problem? Go to this portion or go to this, which is what's fun about the domes, right? Where it's like, oh, you should go here, you should go there. And then guess what? That person can talk to the other person. Holy cow, right? Like you're not siloed.
Communication and healthcare.
Yes, like the older people that I work with that are, 65, 70, and they're like, well, I have this appointment and that appointment and that appointment. And I'm like, did your cardiologist ever ask about this? Like, well, no, he said that was my rheumatologist's job. And it's like,
but did they ever talk?
Can we ever just like bring this all together? Because that's going to blank with this. And then we need to bring this together. And so I think that's where it is how do we bring the silos back together to where there is a communication among providers,
right? And
it's not the patient trying to translate whatever the cardiologist said, but they can't understand them and bring that to the rheumatologist and mesh that. Like we need interdisciplinary, whatever that needs to look like.
Interdisciplinary, comprehensive, integrative healthcare campus. Like that's what I would love to see.
Yeah. And I think that's possible here. You have the land and the infrastructure for it.
Yeah, that got so many different ways we can go with that right now.
Yeah.
So real quick, just kind of towards the last few minutes here, shameless plug, like who are you? Where are you? How can they get a
Yeah. Natural Wellness Physiotherapy is our clinic name. On Instagram, it's Natural Wellness Physio. Me personally, I have a personal mission to reach out directly to people instead of anticipating their doctors referring them to us. And so I've got a podcast as well called Heal Without Harm. And under that umbrella, where I am personally on all the different social medias is the Doctor. So THEDOCDIR. I think I'm punny with the Doctor. So that's where I'm at. I post primarily on TikTok. That's where everything kind of goes filtering down from there. So I have YouTube, Facebook, and Instagram underneath that.
Yeah.
Because there's so many things that I think is very obvious and plain and normal that is like mind blowing to the average patient. And I'm like, well, why don't I just like post those out there so like the whole world can just see it, and then we can have a great conversation on that.
And absolutely give him a follow. I do love your content. It's fun. It's quirky, but it's also like super informative. Like there's a couple of like stretches that I'm doing that's actually helping with a lot of different things.
Good. And that's my favorite. Where somebody like come back like, I've been doing this for the last 2 weeks. Nobody's ever solved my pain, and this one video did it. And I'm like, that is wild to me.
Yeah. Education, the power of education.
Yep. And meeting people where they are. And the algorithms nowadays, like if you're like, man, my back hurts, like, cool. I will probably show up on your For You page within 48 hours just because you said that out loud.
Yes, absolutely. Use the power for good.
Yes. Sometimes I'll just walk through crowds and be like, Natural Wellness Physiotherapy, Natural Wellness. Just hoping somebody's mic picks it up,
Well, Clayton, thank you so much for being here today. We are proud to have you as a community partner.
Yes.
I mean, I consider you a community partner. So if anything we can do to kind of scratch each other's backs, we're here for you.
Perfect. All right. Thank you so much.
Thank you, everyone else. And please tune in for the next episode.
Thank you for listening to the Real Health Podcast. If you enjoyed this episode, be sure to subscribe and leave us a review. You can also find all of the episodes and show notes over at realhealthpodcast.org. Also, be sure to visit riordanclinic.org, where you will find hundreds of videos and articles to help you create your own version of real health.